Muito obrigado. Vamos então aguardar. Quando começar a transmissão, pedir que alguém me confirmasse.
Já está a transmitir.
Muito obrigado, Liliana. Muito boa tarde a todos os que nos estão a ver e ouvir de forma mais próxima aqui no mestrado, mas também a todos os que possam estar a assistir agora ou mais tarde. Vamos ter mais uma sessão aqui do mestrado de investigação clínica. E é com muito prazer que vamos acolher a doutora Esther Monteiro e eu passarei ao inglês para como creio que temos feito habitualmente nestas sessões. Eu chamo Ricardo Fernandes, sou um dos docentes do mestrado e sou pediatra e investigador. Welcome everyone to another session of the Masters in Clinical Research of the Faculty of Medicine of the University of Lisbon. Welcome to all the students and to other attendees online or in the future. So today we welcome, it's my very good pleasure to welcome Esther Montero. And it's very good for me to present Esther because we have so many affinities both on the topics that we work with, but also in the nature and format with which we work, and we have been working together now for many years. She will talk about pediatric research networks, and in particular, the example of a pediatric research network that's very close to us in Spain. But I think you can, beyond pediatric research, you're most likely going to take some take-home messages and ideas beyond that. So, Esther, welcome. I'll introduce you if you don't mind. So Esther has a very interesting career that includes a bachelor degree and a master of science in chemistry and technology by the University of Santiago de Compostela and the University of Vigo, but also an MBA by the Universidad Intercontinental de la Empresa. She has well over a decade of experience in the pharmaceutical and biotechnological industry, both in big pharma companies, but also SMEs and startups, and has worked in business development, but also QA and quality control, and has held different leadership positions. And since 2019, and that's where our paths have crossed, she has worked in business development at GenVip, which is a genetics, vaccines, and infectious pediatric research group at the Institute of Health Research in Santiago. And I have to say that this is an extremely dynamic and well-known and with a large international footprint research institute for what is a relatively small city. And she's currently responsible for the development, coordination of operations and stakeholders management at both national and international and European level within GECLIP, which is a pediatric research network you'll probably hear about. And importantly, we've been together in this very large Innovative Medicines, now Innovative Health Initiative project, co-sponsored with big pharma and academic institutions, where we have together helped build a pan-European clinical research network. And in that sense, Esther has also made very valuable contributions to the business model that has allowed us to now be working on sustainability. We've just been together 2 days, Esther, so sorry for the introduction, but it's a pleasure to host you today.
Thank you, Ricardo. First of all, yes, again, a big thank you for this kind invitation to you, to Professor Ferreira here as well, to Professor Pinto, and of course to the colleagues and friends from CETERA and the Stanford Kids Network. Again, it's for me a pleasure to speak at this ciclo de seminarios do mestrado de investigação clínica da Faculdade de Medicina da Universidade de Lisboa. So I will now share my screen, and you confirm that you can see it.
Just a second. Yes, we can see it in presentation mode, so all ready to go.
Perfect. So the talk is Networks for Supporting Pediatric Clinical Research, the Spanish example. And with that, my goal today for you all, for the students mostly, is to showcase the work we do at RECLIP. And see if I can move the slides. Can you see? Yeah. Can you see the slide, right?
Yes, all working well.
Perfect. Okay, so some background on the need to have pediatric clinical research. So as you can, I am sure you already know that children are not small adults. But it's a good reflection, I think, to start with, and some facts and figures here. So to reflect, only 30% of medicines marketed in Europe include pediatric authorization, and less than 50% of the drugs authorized in children have been adequately tested. So with this in mind, an important aspect here, since children are not small adults, this means that they often respond to drugs, to medicines, different than adults do. But also children and young people may have and indeed have different opinions, and what matters to them is not necessarily the same to what matters to the adults that are around the children. Children grow and mature, and they have biological and physiological characteristics, different needs, for example, from neonates if we compare to teenagers. So age-appropriate research is very much needed. And some history important to have in mind here, what the Nuremberg Code from 1947 stated, and this was that children should be protected from clinical research for ethical reasons. As you know, the Nuremberg Code is one of the most important documents in ethics research. It's a set of ethical research principles for humans. So again, in 1947, when this Nuremberg Code was put in place, children were excluded from clinical research for ethical reasons. But this changed, luckily, in the 80s. And then with the pediatric regulation, which was enforced in 2007, it's from 2006, but enforced in 2007, there was a paradigm shift, a relevant change that, I mean, we moved from protecting children from clinical research to protecting children with clinical research. And this is, of course, a significant milestone. Now, we have consensus that children must have the same rights as adults and access to evidence-based medication, quality, safe drugs, and of course, healthcare services. So clearly a problem to be solved, since once again, and as already said, many of the products used in children were not adequately tested for children, for young people, for babies. And they are still nowadays prescribed and administered based on the pediatrician's own experience rather than on the results of clinical research program. The increase of the pediatric research and the number of new drugs, medicines with specific pediatric indications will minimize that situation and will ensure that off-label use of adult medicines will decrease, and therefore innovative, safer medicines, drugs will be available to children and young people. So we can agree that pediatric clinical trials at this point are essential to ensure that children receive appropriate, safe, and effective treatment and care. So I mentioned before the pediatric regulation from 2006. This was developed and it was established to encourage development of suitable medicine for children, to promote high quality clinical research, to improve also the information available, existing data on the use of medicines in children, and important also to prioritize the therapeutic needs. The regulation entails a combination of obligations and rewards for sponsors of clinical trials, aiming to shift focus to pediatric medicine development. And as a result, and since 2007, we can say that now there is a significant increase, significant amount and quality of research and information available for the pediatric population. So we have seen an increase in the last almost 2 decades. But also important is that this has allowed the development of pediatric clinical research networks involving both academic stakeholders, partners, and also industry. And very important as well is that industry has changed their approach to medicine development, and now the industry sponsors of clinical trials design research, the research and the development plans incorporating pediatric population, and under a also very important a patient centric approach. I have a very short video here that I would like to share. Let's see if it works.
The European pediatric regulation has really changed the landscape of innovative therapies for many children across Europe.
A lot has been done, but there is still some improvement, and we know what the weaknesses are.
Some kind of disappointment with the regulation up so far.
All the stakeholders were really here for one reason: to find solutions for better implementing the pediatric regulation.
We can do better by working together. We can do better by having no longer a drug-centric approach, which has been so far the 10 years of the implementation of regulation, looking at the drugs, but looking at the needs of the patients.
There were lots of people talking about putting patient more in the center, making the patient voice more involved in the final decision making about what drugs are good, what drugs are bad, what are the unmet needs of patients. But it's not only new drugs. We need also to define how to better use the existing drugs. And it's clearly, over the last 10 years, an area which has been neglected. Real problem is within the old drugs that are not licensed for children, are years on the market, have been used for years in children. And there's also some
evidence on using children, but we really need to collect all this evidence and come with good advice for a pediatrician.
I think as we did the 10-year review, there was a feeling that we were coming to the end of everyone's energy and everyone's patience. But I think learning from today, that sort of reinvigorated my interest, and I hope it's provided a dynamic sense to everybody else that there are challenges, but we can overcome them together.
So some colleagues and good friends speaking at the video. So as you have listened, and as I have hopefully transmitted to you, there are still some challenges because this is a complex topic. So now I will focus on RECLIP, the Spanish network of pediatric clinical trials. I will try to explain who we are, what we do, and how we do it. So RECLIP is the Spanish Pediatric Clinical Trials Network, and it was created back in 2016 on the basis of the clinical strength of major pediatric hospitals in Spain, and it has been since then coordinated by Professor Federico Martinon, who is the head of pediatrics at the hospital in Santiago, Hospital Clínico Universitario de Santiago. So this is where we have our coordinating office, coordinating hub for the network, which is formed by many different hospitals. We will see later that across the country, across Spain. And RECLIP aims to provide a fully developed and fully professionalized network of top national clinical trial units across the main hospitals in Spain, always with the focus, of course, on pediatrics. So how we work? We work through a coordinated, centralized effort, ensuring the right environment, the adequate environment, and the appropriate infrastructure for clinical research, with the clinical sites as our core structure, as the backbone of our network for the planning and conduct of safe and effective pediatric research and development. A little bit of our mission, which is to serve as an independent organization able to provide, as I said before, a fully developed and professionalized network of pediatric national clinical trial units and sites. And the vision is to become the reference, the best network of reference for clinical research professionals in Spain across our hospital and the pediatric sites to deliver better medicines for children. In our values, in our daily effort to achieve our mission, we entail values such as integrity, but also innovative approaches, of course, share learning with our partners, but also with colleagues across similar networks in Europe and beyond. Excellence and quality, of course, on what we do every day, and it cannot be achieved the mission, it cannot be achieved, the vision, without joint effort and a teamwork. Just for you all to visualize the structure of the RECLIP network. As I said before, the core of our network and our mission cannot be achieved without the pediatric hospitals, which are members and are key and crucial elements for the activity in pediatric clinical research in RECLIP. So currently we have in our network 23 clinical sites across Spain and 6 thematic networks. I can say that the most, all the hospitals that perform a significant work in clinical research in pediatrics are part of our network. And the RECLIP sites and, of course, the clinical teams, as I said, are crucial elements. And it is also important the engagement between the different hospitals, the different teams at the hospitals with the RECLIP Hub and with our mission. At this moment, the members of RECLIP contribute to the sustainability of our network with an annual fee. This has been a significant milestone during the last year that will allow us to continue our work in the future. And some focus points on how RECLIP works. We work through a single point of contact, both at the what we call the national hub, the central office, and at every clinical site, we also have a single point of access or a single point of contact, which, as you can imagine, is there is a person at each site. It can be a clinician, or can be a project manager, or can be the head of a scientific team at the site that allows RECLIP to contact let's say the appropriate team of researchers or the PI in a specific therapeutic area when it is needed. But it is always, let's say, communicated through that point of contact. And we work centrally, and we coordinate the activities on the sites when planning and conduct a clinical trial or a related activity involving clinical research. We work with them to be ready for a clinical trial whenever it is needed to start at the different steps or phases across the trial. And during those phases and the different steps, we as a central hub support and facilitate their work. But there is also a focus area, which is the clinical expertise we gather and we offer to all the stakeholders. And these are the multidisciplinary experts that come together and work across different boards that are coordinated from the hub, and different working groups in different topics that improve the performance of clinical research. And of course, a focus area is working through a continuous improvement philosophy where training and development and quality and capacity building is always considered. But even with that, and even at the point we are, and with all the progress that we have seen across the years, there are still some obstacles. And these are mainly that, and this is a Spanish experience, and you can tell me later if that's if this is something that you are also facing this type of problems in Portugal. For example, researchers struggle to have dedicated time and dedicated quality time to perform clinical trials. In Spain, there is a gap, and there is a lack of formal or unofficial career plan for clinicians, for professionals who would like or who would want to have quality time dedicated to research. And this is also because there is a lack of resources to organize and coordinate clinical research at the sites. I think it's a good point now, across the presentation to talk a little bit about who are the RECLIP stakeholders, right? There are different groups, different parties with interest in RECLIP and its outcome, and with sharing common goals. So, of course, the sponsors of clinical trials for which there is a specific value proposition from RECLIP that we will see later. The clinical sites and the clinical trial units at the sites, as I said, are also key stakeholders, and there is also a specific value proposition for them. But there are other stakeholders, as research and healthcare institutions across the country, for example. Of course, the European network, Connect for Children, the European Consortium, and the Network for Pediatric Clinical Trials in Europe. I mentioned before expert boards, committees, and working groups. They are also stakeholders of our network, and also EMPREMA, which is the European Network of Pediatric Research at the European Medicines Agency, and many other networks that were born and are working in the area of the pediatric clinical research across Europe and across US or other countries. So on the RECLIP value proposition, I mentioned that specifically for the sponsors and for the sites, we have several points here that we think are benefits for them. So for the sponsors, of course, the access to sites, because when the sponsor wants to start and set up a clinical trial, one of the first activities they need to perform is to find the right sites, the right hospitals to then recruit patients, pediatric patients, for the trials. So RECLIP can provide site intelligence for this preliminary need for the sponsors, which is the site's identification. Through the point of contact of our network, we can provide to the sponsors this access they are looking for. And specifically, and from that point of contact to the clinical trial unit, and then to the PIs and the clinical teams in the therapeutic area that the trial is going to be performed. So again, this is value exclusively for sponsors, but then there are some shared benefits both for sponsors and sites. As I mentioned, the single point of access for to the network, to all the queries and requests. This can be for sponsors of trials in general, but this works the same for the points of contact at the sites who need to raise a query or any request to the central office. And there is professional support in this in all the work we do, because we work with harmonized and consistent processes as much as we can. This is always an ongoing work. We provide support in many administrative procedures to both the sites and the sponsors, and we track and follow up all the activities and tasks that may be needed. This can be the signature of a confidentiality agreement, or this can be supporting on a feasibility questionnaire or in a site selection visit, for example. And value for sites exclusively, I could, or let's say specifically for the sites. For example, we have support and sharing best practices across PIs, across different clinical trial units, but also we have training courses, webinars, or development activities we can offer to the research teams, to the different roles that work in clinical research, either a nurse or a project manager or a sub-investigator. And of course, there is a clear activity and value, but we see value there on networking, allowing networking with peers and colleagues across the sites. That's also something beneficial for them. So in a nutshell, we can say that benefits of being part of RECLIP, it doesn't matter, I mean, from different perspectives, from the perspective of a sponsor, or the perspective of a PI, or from a health research institution, there are many benefits, starting with networking, as just mentioned, and the ability to provide contacts with between peers, the opportunity to engage in expert boards, committees, and working groups, the team support, so the support we provide as a team to the clinical trials unit in different tasks, and of course the support and facilitation on the setup of a trial. In general, these are really good opportunities we provide to the sites to participate in clinical trials for children. And of course, providing access to training and development for on clinical research programs. A little bit on operations of RECLIP, purely in relation to our operations themselves. Again, we conduct services for clinical trials, trying to help the sites, trying to support the PIs and the units, and always tracking these efforts and follow up on open questions or issues or troubleshooting. With regards to management, RECLIP plans and conduct different types of meetings, one-to-one meetings with the sites, meetings with the steering team, the steering committee of RECLIP. We also have internal coordination meetings, and of course we run activities aiming to obtain collaborations, to being able to consolidate agreements with industry to be involved in clinical trials. On a higher level, RECLIP also approaches to the public in terms of we need to do public relations. We need to do, of course, networking. We also approach to activities related with patient and public involvement, and to parents and children within clinical trials, and also on research. RECLIP's work to and try to be at the forefront on grants, applications, or public consultations, or funding mechanisms, funding schemes as well. And just very quickly, so we have time for comments and discussion and questions. So, and I mentioned this before, that RECLIP's work through a single point of access for the different activities we see here on when working with sponsors of clinical trials. They can be from industry for commercial trials, or they can be academic trials. For example, on country outreach or feasibility phases, on sites assessment, also providing value on and activities on recruitment support, or on essential documents collection support, which is something we try to facilitate with the sites. And finally, some endorsements and support, which are indeed very important and are part of what I mentioned before, what we consider the public relations and the development of the network. So we have received endorsement from the Spanish Agency of Medicines, but also from the Pediatrics Spanish Association, from Pharma Industria, who is the trade association of pharma companies in Spain, similarly with AMIFE, the Trade Industry Association of Pharmaceutical Medicine. Also to mention that RECLIP is a Category 1 member of the European Network of Pediatric Research at the EMA, which has significant activity, of course, in everything involving pediatric clinical research, but specifically with different working groups, guidelines, guidance documents, etc. And of course, with the European Network of Pediatric Clinical Research with Connect for Children. And I think this is my last slide. And yeah, so I think I pause here and thank you for listening. And I hope we can have some brief discussion or some reflections now. Thank you.
Thank you very much, Esther, for that comprehensive overview of what RECLIP is and what it does. And I think that's good as an introduction, because there's a lot of granularity that we could go into depending on the student's interest or any question. So I can have a couple of questions, but I'd like to hear from the students if you want to ask Esther any question, and I'll try to keep an eye on the YouTube channel too. So questions for Esther, be it in English, Portuguese, Castellano, in Galician, which is very close to Portuguese, so we're open to questions.
Ricardo, can I start?
Of course.
Okay, thanks, Esther, for for being available and for joining us at our Lisbon school at the University of Lisbon. It's really a pleasure, and it's also good to have Ricardo sharing, because you work together, so he's the right person to make the bridge with us. My questions are very, very pragmatic, related with RECLIP, so with the structure. The question is where the funds come, so who is funding, legally where it is based, it's one again, and I'm trying to to have this opportunity, because this is some of the things that we struggle. Is it I would say an autonomous entity, or it's based in one of the centers? That for me it's important. And the third one is, what are the obligations of the centers when they are approached directly regarding a trial or regarding a study, to bring that study to the network, to the RECLIP, and what can be done? And sometimes, and again, I'm not even saying that this should be mandatory, because there are some, even the sponsors sometimes have their own rules. And some of them want to conduct studies, in some specific studies, some centers, if everything is mandatory to have like a pathway in terms of, the first approach, it may limit, the potential of some centers. So really funding, it's one question. Where is it based legally? And what do you do as a center when you are approached directly? And what are the procedures? And again, thank you very much. It's again, congratulations, We tend to envy when things work well in a difficult field like pediatrics.
Thank you very much. Very, very good questions, by the way. So yeah, good. It's important to clarify. Yeah, RECLIP currently is hosted by the Health Research Institute of Santiago de Compostela, which is I think you have similar.
So it's one of the centers plays like the host, correct?
Say that again, sorry.
One of your centers ends up hosting the legal structure.
Yes,
okay,
exactly.
Okay.
So RECLIP does not have its own legal entity, right? This has been in discussion from many years. And the thing is that when this was discussed at steering committee level and with the relevant institutions in research institutions in Spain, the legal entity of RECLIP, a specific legal form, could limit or minimize the ability for RECLIP to grow or to apply to different grants or other mechanisms. So it was decided to be hosted by this public institution, the Health Research Institute in Santiago. So as you have seen in one of the final slides, we have support and we have endorsement from the main institutions. But the decision, again, was made by the steering committee to proceed in this form. And with funds, with the funding that RECLIP needs to survive, since 2022, we had put in place a business plan that made a significant change in the way that the sites, the obligation of the site, of a site, to contribute with a reasonable amount of money for the development of RECLIP. This is the funding we will have the main income. In addition to that, of course, we have been part of the European Clinical Network, and as a partner, our institution has been able to grow and to be alive until now. So the business plan from 2022 precisely wants to minimize the risk of not being able to survive, and with that, the income we receive from the sites is key and crucial at this moment. We also have.
So there is a fee. So Esther, so there is a fee. There is a fee that each center, pays to the Santiago de Compostela Institute, correct?
Correct.
Okay.
Correct.
Okay.
That's correct.
Okay.
Yes.
It's the same for all centers, or it depends on the number of trials?
Depends on the category of the site.
Okay.
Yes.
Okay.
We have some sites that are under the category of consolidated sites. This is main players in the clinical research, and there are others that are emergent sites that their fee is, let's say, a less small amount, and the same for thematic clinical sites. And regarding the so I hope I answer.
Yes, perfect. Again,
you
don't need to open all the game, but just for me to understand. And what about if one of the sites is approached for a trial? What should they do? What do they need to do?
Yeah. So here we have. I mean, it's very much dependent on the point of contact or on the clinical contact or the PI who is approached, I have to say, because of course there is no legal obligation.
Okay. No strict rules. No
exactly.
Strict rules. Okay.
So
got it.
So yeah, it's as simple as a PI may respond to a sponsor. Okay, we have a network working specifically in pediatrics that you should contact, you should reach if you want to have for your trial, if you want to select and if you want to open the sites that are more appropriate, the right site for your trial. Okay. But that's very much, I mean, it's nothing which is an obligation.
I don't want to monopolize, so I pass the word now to Ricardo again. And thank you, and congratulations. I know how difficult it is, so good.
Thank you very much. You're welcome.
Thank you, Professor Joaquin. I ask if anyone has an additional question from either of the students. We also have some clinical pharmacology colleagues today, both interns and specialists, and people on YouTube. Trying to keep an eye on that. Any questions? You can always chat, and you can always reach out to Esther later if you want. I would probably close with one question and with one comment, which is a follow-up to Professor Joaquin's comment in your answer about how you need to do things in a flexible way, right? And you work in infrastructure. Often infrastructure is forgotten. So funding-wise, it is hard to work in this field where we try to ensure the right conditions are there for people to conduct their studies or to coordinate their studies when they're working on sites or to monitor and develop their studies when they're sponsors, be it them academic or not. And I think one aspect of having to adapt is because there's an aspect of going to try to fill in the gaps, right? And support where is needed. Sometimes it's a lot, sometimes it's minimal, sometimes you just have to back away. And part of this is relationships and human relationships. So even in an AI world, we need to keep that in mind. I'd like to ask you, so I know that Esther, for everyone on the link today, so it is very important to know how Spain has been progressing enormously in the past couple of years to become currently, by some metrics, the critical player in clinical trials in Europe, in industry. That may not apply to all fields, and you've shared with us some challenges, but I know you've done some work with Pharma Industria, who has also been very relevant for these successes. So could you tell us a little bit of the types of things that you do with them?
Yeah, yes, I think in the recent, the most recent report, I think it's precisely from Pharma Industria, there has been an increase in the number of clinical trials performing in Spain. This has many, I think there are several reasons for that, but I think there is always a common comment on that, which is the how the research is the universal research, the universal healthcare institutions working in Spain with being, in addition to being a universal healthcare system, I think the pediatricians, but not only the pediatricians, I mean, all the doctors, all the medics, all the nurses, and the different roles in the field have a key role in this. And in addition to that, even with the different, the different regions and the different autonomous communities that may have a negative impact on this universal approach. Even with that, and I can say that this has been seen as a positive aspect, which is, I mean, a little bit surprising, but it allows to have many hospitals, many specialties across the country. This is, I think, not the perfect environment, but one good example of environment for the sponsors of clinical trials. and there are many aspects definitely to be improved. And there, I think RECLIP in our area of pediatrics can play a role simply by facilitating and supporting, and as you have said, which I think is key, being a player, but able to connect, to reach the right investigator, the right team, the right study coordinator, or the right nurse in clinical trials at each site. That's or even to the legal teams that struggle with contracts or with admin tasks. If the sponsors see the facilitating role we play, and we can, of course, demonstrate that with turnaround times, with minimizing errors, doing things right first time. That I mean, that in summary, always go to a good outcome, or let's say minimizing at least the risk to fail. And I think there may be different nuances or specifics across the regions, but in general, this is how it is seen.
Thank you very much, Esther. I don't see any more questions unless any of my colleagues supporting us today tell me there is something that I may miss. I don't see anything on the chat or anything here. So thank you very much for the presentation. It's been a pleasure to have you. Thanks everyone for attending. Thank you to the support, and we'll see you soon.
Thank
Bye-bye.
you. Thank you very much. Bye, everyone.